year, Americans spent nearly $13 billion on cosmetic procedures. But how many of those people are actually happy with their results after they get the plastic surgery? Our next guest just launched a company that allows people to see what they will look like after the surgery before actually going under the knife. Joining me right now is Carrie Smith. She is the founder of Mirror Me 3D. Carrie, good to have you on the show.
Thank you, Carrie Stern.
Carrie Stern, my apologies there. And Carrie, you actually brought in a makeup of This Is You.
Mm-hmm. So this is a full face.
So what did you want to have done, and what are you showing us?
So this is just a baseline. Nothing was changed on my actual image here, but the purpose of this is to show you how realistic the prints actually are.
And so right here, you didn't do anything different.
No.
Yeah. And so what do you want to do?
For myself?
Yeah. What are you trying to show us?
Why would you want to
This is just to show how, I mean, the purpose of bringing the model of myself is to show how realistic the prints are. But for patients, we can print their baseline, but also show them simulations, what they will look like following surgery.
How many people are unhappy with the surgery? I mean, how significant an issue is that you're unhappy with the surgery after you get it done?
I don't know how many people are unhappy, but I do think that giving patients tactile models enables them to visualize a little bit better what they will look like.
But what about, because it's up to the surgeon, right? So what you could present a model, someone decides to have a nose job, a facelift, an eye lift, whatever. You give them the model, it looks fantastic, but then the surgeon doesn't execute in the way, I mean, they don't wind up looking like the printout. And that, how big of a problem is that? Because they have to get over that hurdle. Because
Right.
some surgeons, great, some surgeons, not so much.
Exactly. So a lot of physicians these days, plastic surgeons, use simulation technology in their offices where they take a 3D picture of a patient, the patient comes in and they do a simulation, whether that's for a breast augmentation or rhinoplasty. But patients don't really understand or can't really visualize what they're really going to look like. And so offering the prints helps patients with this tactile model.
You were a plastic surgery resident and you took time away from clinical medicine to start this company.
Mm-hmm. Exactly. So over the last few years, with increasing technology, both in printing and 3D simulations, I noticed that there were some gaps in the consultation process. And I realized that most patients come into consultation with cutouts in magazines of what some actress that they would like to look like. And it's
horrible.
It's really difficult.
Is it even possible to say, look, I want to look like this person and possible for a plastic surgeon to do it?
It's very difficult.
Exactly.
Patients have unrealistic expectations.
Right.
So even if you do a 3D capture, do a simulation, it's not great. So printing it for patients, we found that patients really were interested in taking a model home and showing it to their friends and family. And doctors were really interested because they can both educate their patients, but also get rid of those photo books that they have, showing patients what their best before and afters, but creating sort of medical displays for the office and showing patients, this is what a similar nose that you have now, and this is what the result would be.
Carrie, a couple business questions. Are you the only ones now doing this, or do you have competition?
So in the plastic surgery space, we are the only people doing it.
I think this
That's
is
surprising to me.
amazing. So now,
It's amazing.
Do the doctors outsource this to you, or is this some kind of software and hardware they bring in-house that they would buy from you?
So we are the printing house essentially. So most doctors will need to have some sort of capture system where they buy, whether it's a scanner technology or a 3D camera, and many doctors already have that in their office. They send the images to us, and we print them and send them either to the patient or the doctor.
You got to do full body.
Yeah, right. That's
Amazing
right.
stuff.
We do have breast models too.
And by the way, real quick, in terms of plastic surgery, the business in general, I mean, this is obviously an elective surgery. In an economy that's not growing very much, are people still spending money the way they have been on this? How would you characterize it?
I do think so. I think people are still spending money on plastic surgery. I think patients want to take a little bit more control of the process. So another thing that we're launching now is a patient portal where you don't need to ever see the plastic surgeon initially. You can come to our site, upload 2D pictures of yourself, do your own simulations, see what you may or may not look like, order your own prints, and then find a plastic surgeon of your choice.
That is very
awesome.
cool.
Wow.
Really cool. Carrie,
Awesome.
good to see you. Thanks so much
Thanks
for joining
for
us.
having me.
Carrie Stern is the founder of Mirror Me 3D.